वेलकम टू निरोग स्ट्रीट। आज हम बात कर रहे हैं डायबिटीज़ के बारे में, जो कि है बहुत ही कॉमन और डेंजरस बीमारी। इंडिया में हर 5 इंसान में से एक इंसान को डायबिटीज़ है। तो हम स्वागत करेंगे डॉक्टर गीता कृष्ण जी का, जिनके पास है 20 इयर्स का एक्सपीरियंस और ये है डेयर इंटीग्रेटेड मेडिसिन वेदांता मेडिसिटी के। वेलकम डॉक्टर। तो आप हमें ये बताइए कि डायबिटीज़ एग्जैक्टली है क्या, और आयुर्वेदा में इसके कितने टाइप्स हैं?
Diabetes is basically when your body cannot absorb enough quantity of sugar, or rather, there is a lot of sugar present in your body. In simple terms, it's glucose, sugar present in your body, but your body cannot utilize it. That condition is called as diabetes. Like, so it is basically a starvation during abundance. Like, there is one single chemical which is formed from a gland in the body, which is called as pancreas, and this chemical is called as insulin. And insulin helps the blood to the cells to absorb the sugar which is present in the blood into it. Like it helps it to open up the pores of the cell membrane, and allows it to go inside. In the absence of insulin, what happens is that the cells won't allow the sugar to go in. So there will be a lot of sugar outside in the blood, but there will be not enough sugar within the cell. So what happens is sugar is very, or glucose is very much essential for every function of the cell. When sugar is not available, the cell will start decaying, or start utilizing its own other organelles. Like there are many material within the cell which the cell uses for its own function. But when there is not enough sugar available, it will start utilizing its own different organs. What happens is that the cellular level, there is a slow decay which is happening in insulin, whereas in the blood there is a lot of sugar available. In this condition, uh, what happens is there could be a lot of opportunistic organisms, etc., which is happening, which is running around in the body. It could also lead to, in one way, your cells are decaying from within, whereas in the other side, you are giving an opportunity for external organisms or external environment to grow well within our body. So what happens is our body, in one side our body is decaying, whereas other side we are providing nutrition to external factors to grow within them. So infections can happen. At the same time, our body is not able to overcome that. There could be like huge amount of starvation, wherein which people will have high levels of sugar, but their like the body cells will be starving, and they will actually sometimes even faint. Like sometimes the blood sugar levels can go so low that, because people keep on like starving themselves out to get out of diabetes. Then they have other problems, like hypoglycemic effects in diabetes. These are all, uh, there are many conditions. Diabetes is a very vast kind of a disease which involves almost every single system in our body. But its effectiveness is very huge. Like we in Ayurveda call it one of the Maharogas. When we call it Maharoga, it means that it is not a severe disease. It can be severe disease also, but diabetes is called as a Maharoga because it can cause hundreds of other diseases. It can be the root cause of hundreds of other diseases. Ayurveda, it is said that if you are managing your diabetes well, it is one of the best diseases to have. We call it Anushanginam Shrestha. Right? But the only thing is that you need to keep it very well. You should consider it like you should take care of it like a child, and make sure that it doesn't harm you. It is like a dangerous thing which you are always carrying with you. You cannot throw it out, but you need to know how to manage it. So Ayurveda also deals with how to manage it. That's more than anything else. According to Ayurveda, there are like two different kinds of diabetes. One is something which actually happens at very young age, and another one is something which happens later. Like so, juvenile diabetes is one of that, and because when you start having diabetes at a very young age, and the other one is the kind of diabetes which people develop as they grow up. Like so, in general terms we can say that it is type 1 diabetes and type 2 diabetes, which is very common classification of diabetes in modern medicine also. There are different kinds of treatments available for this. Mostly, as I told you earlier, it is kind of like lifestyle modification, that's more important. So when we talk about diabetes, it is said that like you should make your food habit very very careful, and then even the grains which you use should be basically of low glycemic index, or rather your body should be able to digest it, but you should the food should not release too much of sugar, or it should release sugar in a very slow manner. Like different kinds of like grains and pulses and vegetables have been explained in Ayurveda, which people should be using. Even the kind of non-vegetarian food also which people should be having had been explained. What are the things which should be avoided are also been explained in Ayurveda. For example, in a diabetic patient, the best situation is that he should avoid all fermented food. Fermented food are things which are kept over a day, and then allowed to change in its character and then taken. Then they should be avoiding sprouts. Sprouts also is something which should be avoided, even though we know sprouts are something which can be easily digested. Ayurveda says that you should keep away from sprouts, because the reason is, even though it is, we look at the digestibility of sprouts, but we do not think about what are the things, the chemical changes which happen in a growing seed while it is growing up. So these changes have been observed by Ayurvedic Vaidyas, and they have said that keep away from sprouts, because you don't have one sprout or two sprouts, you have a bowl of sprouts. So when they come in large quantity into the body, it creates changes, metabolic changes within the body, which could lead to diabetes. Another one would be fish. Fish should be avoided according to diabetic patients. Fish is not something which is good for diabetic patients. Also is in food prepared from dals, especially udad dal, and like the large dals like rajma and etc. But moong dal is perfectly good for diabetic patients. Arhar ka dal is also very good for diabetic patients. It doesn't cause a problem. Moong dal is the best as far as dal is concerned. All as far as rice is concerned, there is one rice called a shastik shali, which is a red long variety of shali, which is very good for diabetic patients. Most of the vegetable are fine, but melons are something which we ask people to slightly keep away from during diabetic cases. We are also very clear that diabetic patients should not take a mixture of fruits, and they should be taking different kinds of fruits at different times, and but not in large quantity, and fruit should not be mixed with other foods. Like for example, you are taking rice, do not take any other fruit with it. Fruit should be a separate fruit at itself. Like for example, you can take a bowl of fruit towards afternoon or in between your meals, but do not along with any of the other foods. Now, if you look at preventive aspects of diabetes, Ayurveda says the best option is to look at it from the point of view of your susceptibility to diabetes. Diabetes is something which can happen from generation to generation, and if you are susceptible to diabetes, then you have to be very careful. Ayurveda also suggests, like in modern medicine, which has recently come up and with ideas of how to change your lifestyle, says that you should walk for a long period of time, you should like reduce the quantity of food that you take, you should sleep well, that's very important in diabetic patients. You should make sure that your body is kept clean, taking good
Hygiene should
hygiene.
be.
Bath is very important. What kind of oil to be applied, for example, Ayurveda has a very specific oil which is usually called as Amritadi oil. There are different companies which manufacture. It's a traditional medicine which can be applied for diabetic patients, and it improves their vascular supply in their limbs, etc. If somebody has peripheral neuropathy, like patients come with long years of diabetes come and say that while I walk, I cannot feel that my legs are there. It's kind of a padded kind of a leg. I think that my legs are covered, or I cannot feel my leg. There is numbness in my leg. There is pin pricking sensation in my hands and legs, etc. This is called as peripheral neuropathy. For that, we use a medication called a Supti Thailam, which improves the sensation of these patients. There are also medicines which we give to such patients, which are useful in many situations. But specifically for such patients we give certain medications, which I think is not the purview of this discussion. But it is better that if there is a situation like peripheral neuropathy, the patient should meet an Ayurvedic doctor and consult him or her and get a proper medication. There are medicines available.
So I would like to interrupt here. So जैसे आपने अभी कहा कि patients should consult a doctor when they feel numbness in their hands. So sir, what are certain points when a person should consult a doctor, like particularly a doctor?
If your parents or any of the parents or anybody very close to you, blood relation in the family, has been having diabetes on a regular basis, you should start checking for diabetes from the age of 30 onwards, especially Indians, because not because we have any specific genes or anything, we are more susceptible or anything. We are suddenly getting exposed to a group of food habits and lifestyle which we are not used to. Like, we eat quite a lot, we eat in odd hours, and we sleep at odd hours. We are exposed to a lot of pollution, and our body is under a lot of stress. Whether we understand that or not, that's a different thing, but our body is definitely under a lot of stress, and diabetes is strongly related to stress, or rather, these metabolic changes are strongly related to stress. And in such cases, people should start looking for symptoms of diabetes very early in life. That's at least at the age of 30. So what is the simplest thing to do? Go and do a blood checkup. First thing would be to better to get a fasting blood sugar level, followed by a post food blood sugar level checkup, which is about 1.5 hours after you are given a quantity of glucose to drink, and then they check that. This is very one of the simplest tests. Something which you can regularly take up as a test for diabetes is to see your HbA1c level, which is the quantum of average quantum of sugar which your blood is carrying, and which is an average number which you take every 3 months. If you're not diabetic, you don't have to do it on a 3 month basis. Like, at least once in a year for an age group from 30 to 40 should be done. It is very essential. You should also check whether your lipids are good, your cholesterol levels are good, because the cholesterol levels changing and you being getting into a diabetic stage also has close relationship, because both are metabolic disorders. Your chemicals change, the normal chemical processes in the body are changing. The metabolic disorders are, when happens when the normal system of chemical changes, which usually should be happening in the body, make small alterations, and then shows up as increase in blood sugar level or increase in cholesterol levels, etc. So these are things which you should look for. You should also look for thyroid problems. Like, some of the diseases might diabetes has diabetes, I shouldn't say that has a direct connection to thyroid and thyroid diseases, but it is better to check for the thyroid also while you are checking for your diabetes, because once in a year it is definitely sure. Once, if somebody is above the age of 40, and if any of your parents have been diabetic, it is better to check for diabetes every 6 months. There is no doubt about it. And HbA1c levels once in 6 months will give you a fairly good idea whether you are changing towards diabetes. And then get a doctor consult. Like, once in a year, get a doctor consult and see whether you are doing things right. But most importantly, what you should look for is extreme tiredness, which you don't
These
feel
are
like.
the symptoms
These
of
are the symptoms
diabetes.
which you should look for. If you're not necessarily, but you feel like very tired. You feel like eating sweets, or craving for sweets. Not everyone who has a craving for sweets have diabetes, but suddenly somebody develops craving for sweets, craving for eating something, etc., etc., at odd hours, has needs to check for diabetes. Somebody who had been quite okay, and suddenly starting getting to feel very tired unnecessarily of due to no reason at all. Let us say somebody who is regularly losing his sleep is feeling tired is a different thing. But somebody who has no other reason and doing everything normal suddenly feels that I am very tired, needs to check for his diabetes. And somebody who has a wound which has happened and which is not healing should definitely go and check his diabetes or her diabetes, because it's something which could be a because you would not have noticed at all, but probably that person would have been having diabetes for the past few months or years at all. So this needs to be checked and on a regular basis. Otherwise, small changes in your vision, visual acuity, is also one situation where you should go and check for your diabetes, because some people, their problem with diabetes actually are observed with their visual acuity changing, because it also says that once you're from Ayurvedic point of view, once your vision starts decreasing or changing, it says that this it's an earliest sign of your body getting ready to become old. Like, so you need to start looking for it. And you should also check once in a year, your kidney functions. Like, this is also very important, because sometimes people come to know that they are diabetic by looking at their kidney function. Unfortunate, but that's how they find it out. So one is, you need to definitely check all these things to make sure that you are not diabetic. And that's very important. Yeah. Definitely after the age of 40, once in 6 months is a good idea to check for diabetes. In order to prevent diabetes, one of the best things which I can say is that eat only when you are hungry, and eat just less than what you want, like what will fill up your
Don't
tummy.
overfill your stomach.
Never overfill your stomach. And eat on regular time. Like, regular time can be of two different things. One can be to the clock, say that at 1 o'clock I will eat. One can be that when